Good day, everyone. My name is Gwyneth at Competente. I'm a student nurse from Lipa City Colleges. I'm excited to be here with you today to discuss some important topic that can benefits for us. Today, we'll be covering what is post-traumatic stress disorder, the signs and symptoms of PTSD, and their treatments. My goal is to provide you with valuable information that can you apply to improve your health and well-being. Please feel free to ask questions at any time. This is an open and supportive space for us to learn together. So let's get started. The overview of post-traumatic stress disorder or PTSD. It can develop after a very stressful, frightening or distressing event or after a prolonged traumatic experience. So first is, what is trauma? Trauma is the lasting emotional response that often results from living through a distressing event. It could be one incident or an ongoing event that happens over a long period of time. So, ang trauma po ito ay sobrang nakababahalang pangyayari o kaganapan na maaring pagdaanan ng isang individual. Pagkakaroon ng takot at pagkapalisa ay ang pinakakaraniwang emotional response na pinapakita ng mga individual na dumaranas ng iba't ibang uri ng trauma. The next is signs and symptoms. It can be divided into categories. Intrusion. Stress is could either be directly to the patient or by witnessing the trauma indirectly. Avoidance. There are intrusive symptoms such as recurrent thoughts related to the trauma. This could be distressing, nightmares, dissociate reaction, such as flashbacks, which can include a complete lack of awareness of surroundings. Also included here is intense distress on exposure. Avoidance, where people avoid stimuli related to event or reminders such as people or place. Mood and cognitive alteration are common, such as unable to recall certain aspects, a distorted sense of self or recognition, in which they blame themselves for the event. Fear and guilt are also common. Other symptoms including aggressive behavior, hypervigilance, difficulty in concentrating or sleeping, and reckless behavior. The risk factor of developing PTSD or post-traumatic stress disorder seems to be higher in females in people with pre-existing mental illnesses like anxiety or depression, childhood adversities, or a lack of social support. The type of severity of the trauma also plays a vital role with assault-based traumas rather than non-assault traumas like natural disaster being more likely to cause PTSD. I mentioned indirect or secondary trauma where people are not directly exposed to the trauma themselves. Healthcare workers are frequently exposed to secondary trauma and are the highest risk of PTSD itself, can also predispose to other conditions like substance abuse. The first line therapy is psychotherapy, including cognitive behavioral therapy, which has been shown to be effective in between 60 to 80% of cases. It is a way of helping to adjust negative thoughts, feelings, and behaviors that prevent patients from enjoying a good quality of life. Second is eye movement desensitization. It's the process of debilitating and traumatic memories. Third is medication are also useful, including antidepressants and anxiolytics have not been shown to be more effective than psychotherapy. And dapat before mag-take ng medication is magpa-consult muna sa physician po or sa psychology therapist before mag-take ng medicine.